I grew up around sports my whole life, football, lacrosse, all my friends played in leagues growing up, and I was always interested in sports. I like to be busy, I like to be active and exercising and competing, and I find that stuff very energizing. And then as time evolved and going to residency, doing orthopedic surgery, I was just really drawn to the type of surgeries that are involved with sports medicine and getting people back to doing what they love. My name is Dan Zuchelli. My specialty is orthopedic surgery and sports medicine. Just think back at a lot of the patients I took care of over the 5 years of residency that helped guide me as to how I want to be a physician and how I want to continue to help people get back to what they want to do. We talk about the power of the mind all the time, and I think it's really, really critical that you stay positive because negativity and feeling like hopeless and that you're never going to get better really affects your pain and how you live. Eating right, I think, is very important. I think sleeping is also very important, very underrated part of having a positive mindset and overall generally good well-being. And then I think being active is really important. Whatever your choice of exercise, whether it's running, swimming, biking, lifting weights, playing sports, doing yoga, I think those three things are probably, in my opinion, the most important things you can do. I like to compete in triathlons. On my busiest week, I'm doing some elements of biking, swimming, and running. Running is probably my favorite, and when I'm very busy and I don't have time for all three, I usually tend to lean on running. Throw your shoes on, throw some shorts on, and you just go. You can go anywhere, really. It's funny, my wife was in medical school at UConn here in Farmington, and I was at Stony Brook in Long Island, but we actually couples match. So the way the match works is you apply together. So you only accept certain combinations. One of our matches was she was at Mount Sinai doing family medicine, and I was at SUNY Downstate in Brooklyn, and we got that match, which we were very, very happy about. So we spent 5 years in New York City. I love being at the beach with my family, my two kids. I think that's one of my favorite activities, and the Connecticut shoreline is beautiful in the summer. And then football season coming up. I'm a big Jets fan, so unfortunately, but. This was part of my fellowship at New England Baptist. Fellows were one of the assistant team physicians for the Celtics. It's really fun to work with the professional athletes and see some of the injuries that they have at a really high level. The highlight of the year has to be when they won the championship. Obviously, that was a really awesome experience being able to be in the locker room and hold the trophy. And when you compare it to a more recreational athlete, I think that it's still important that you follow some of the same principles. You stretch, you warm up, you do things like that. And then afterwards, the recovery is also important. Making sure you're eating right, making sure you're sleeping, making sure you're resting, and not pushing it too hard again afterwards. The most important thing is taking a patient-centered approach. Really listen to people, what they want to do. Somebody that's just trying to get back to walking upstairs without any pain in your knee, or are you somebody that's a high-level pitcher that's trying to throw a 90-mile-an-hour fastball again because your shoulder's bothering you. Sometimes people wait too long to see specialists, and that problem may be bad enough that it needs surgery, but if they saw somebody when the pain first started, you potentially could have avoided surgery. All kinds of different non-operative modalities you can do to get rid of pain before things progress too significantly. Being active is such an important part of your health, and getting people back to that, I think, is why I chose sports medicine.